We're going to go ahead and get started again. So I'm really excited about tonight because tonight features a topic that we've never done before. And we've kind of been doing this together for a while. And this is a topic that's new to us, but it's one that's pretty exciting because what you're going to hear tonight is kind of cutting edge stuff. So hang on to your seatbelt and take lots of notes because you will not have heard it before, and you will have heard something that many around you will not have heard before as well. So we're talking about lung health, and thank you, Dr. Howe, for being here.
So Sheryl usually chooses the topics, and then I look over them and say yes or no or whatnot. And she handed me this one, and I almost said no because, well, I did. And then I thought, well, maybe I should study up on that because I've never known anything about lifestyle and lung disease. I mean, what do you eat that helps your lungs, or what do you do that helps your lungs? And the first thing that I did is I called up my son, who's a pulmonologist. I thought a pulmonologist should know something about diet and lung disease, and he said, "Dad, they didn't teach us that." I thought, great. But he said, I know someone that works in that field, and he worked with him at the University of Michigan. And so I looked up his name on the internet, and I started reading articles about lung disease and diet and lifestyle, and I thought this is really interesting. Number one, most of the articles have been written in the last 10 years. This is not something that I've known about before, and I've had many patients with these diseases, and I never told them anything to do with their diet. I just said, take your inhalers, take your puffers, stop smoking, which is still important. Live on a more pure planet, if you can find one. Air pollution's bad, good air's good, but nothing about diet. Well, so now if I have a patient, since I've studied this with lung disease, I'm going to talk to them about things that you can do. Before I get into this specifically, though, what did we talk about last time, a month ago? The gut, right? The gut and the microbiome. I'm going to talk about the same thing tonight. Robert Dixon was the pulmonologist that my son referred me to, and he's written a lot on the gut-lung axis, how the gut influences the lung. Well, last time we talked about how the gut influences the heart. Remember, we talked about gut feelings and some of those things, and the microbiome, and how if you eat one way, you'll be more adventurous and courageous, and if you eat another way, you'll be more anxious and depressed. If you weren't here, you can look that up. I think it's on YouTube now, is that right? Yeah, YouTube. So you can look that up from last time. But we're going to talk about the microbiome again. And we're going to talk about inflammation again. Inflammation underlies all chronic disease. And I should have known that was true about the lungs, and just didn't put it together until I started reading some of the most recent literature, all within the last 10 years and more within the last 2 to 3 years, which is very interesting. So, number one, asthma. What can you do for asthma? Well, you take your albuterol inhaler, right? That's what you do for your asthma. Well, that treats it, but it doesn't fix anything. So I put a few studies there, referenced them. British Journal of Medicine, the journal Thorax in 2009 found that if you ate more fruits and vegetables and less burgers, you had less asthma. Well, that was interesting. And you say, well, why? That's what I want to know. Well, how does this work? Another study published in Nutrition and Clinical Care in 2020 said if you have asthma and you switch from a standard American diet to a plant-based diet, the asthma markedly improves. Well, why? Well, the reason is the gut microbiome. And you'll find this is true throughout the whole lecture tonight. What happens is if you switch from a standard American diet and cut out burgers and chicken and cut down on oils and cut down on sugar, the inflammation in the body goes down for two reasons. First of all, you are increasing fiber and antioxidants, and secondly, you're reducing foods that cause inflammation. Everything you eat has to be burned, right? Just like you put gas in the car, what does the car do? It burns it. You put food in you have to burn the food. I don't mean burn it in the pot. I mean your body burns those calories. But burning causes inflammation, oxidation. And I've used this study or referenced this study before, but I think it illustrates it very well. They took a group of people and they measured their inflammatory markers in their blood, and then they fed them a baked white potato and measured their inflammatory markers afterwards, and the inflammatory markers went up. You'd expect that because they were burning the baked potato and, you assimilating it. Then they took the same people and they fed them a yellow potato, and they measured their inflammatory markers before and after, and the inflammatory markers went up half as much. Why? More antioxidants in the yellow potato than the white. And then they fed them a purple potato, and the inflammatory markers went down. Down? Yes, down, because there's so many antioxidants in the purple potato, which is why my wife and I planted all purple potatoes this year, just like we did last year, because I like my food to reduce inflammation rather than increase inflammation. And that illustrates what colorful fruits and vegetables do. They reduce inflammation. What you had tonight had thyme in it. That's colorful, it's rich in antioxidants, and that reduces inflammation. And that's what we want, is to reduce inflammation. It also had garlic in it, and the allium family, and it had scallions. The allium family is very good at reducing inflammation. So ramp up your garlic. It'll reduce inflammation for several reasons. One of them is inflammatory people don't come around as much. Only your really good friends. But, garlic is wonderful for you for many reasons, and that's certainly one of them. Reducing inflammation is critical because asthma is an inflammatory process. If asthma gets really, really bad, what do they give you? Steroids, right? Corticosteroids, which turn off the immune system, reduce inflammation, but unfortunately, they cause lots of problems. They're turning down inflammation, but at a cost. Most of the medications we use are not harmless. They're helpful, but there's also a harmful part to them. And that's certainly true with the steroids. They're wonderful medications. They can really help asthma, but they cause other problems like increased infection rates, osteoporosis, diabetes, hypertension, and some other things you don't want. So anytime that you can change your diet and address inflammation, you're far better off to do so. And when you eat more plants and less burgers, that's what you're doing. You're tuning the immune system so that you can resist disease, but down-regulating inflammation. So it's a double win when you address asthma with improved diet. The next one is chronic obstructive pulmonary disease. Another, one of the types of that is emphysema, which you've all heard of, I'm sure. And, you know, I always thought, well, it's just smoking or exposure to secondhand smoke, or it's air pollution, and it is all of those. All of those cause chronic obstructive pulmonary disease. Now, chronic obstructive pulmonary disease is a condition where you can get air in quite easily, but you can't get it out well. What actually happens is the lungs lose their elastic recoil. If you think of their lungs, they're sort of like a balloon. It takes some effort to get the air into a balloon, but then you relax your grip around the neck of the balloon and the air just comes out. Lungs are the same. Takes a little work to get it in, but then you relax and the air comes out. But in obstructive lung disease, the lungs are more like a cellophane bag and less like a balloon. They lose their elastic recoil. And so the work of breathing goes up. You go, and one of the things we measure to assess the severity of obstructive lung disease is how much air you can get out in the first second. It's called the forced expiratory volume, 1 second. FEV1, how much air can you get out in 1 second? Now, I don't want you to all do this, because if you do that tonight, you're going to be breathing heavily on everybody, and you don't need to do that. But if you can imagine yourself taking a really deep breath, and then you put a tube in your mouth and you blow out as fast and hard as you can. If your FEV1 is low, that means your obstructive lung disease is bad. And you'd like that FEV1 to go up. Makes sense, right? How much air can you get out? Now, some of us have lots of hot air, and we're not talking about that kind. I'm fairly high on that range. Just ask my wife. We're talking about how much air you can actually move within the first second. And with many of our lung diseases, including asthma when it's in flare, you can't get much air out in that first second. Well, they did a fascinating study. It was published in Nutrients in 2017. They took patients that had chronic obstructive pulmonary disease, and they gave them a single meal. Not a bunch of meals over a long time, but a single meal with 3.5 grams of soluble fiber in that meal. And what they actually used is inulin. Has anyone heard of inulin before? Yeah, what do we find inulin in?
Like Metamucil is all inulin.
It's got some in it.
Yeah.
That's right. Jerusalem artichokes or sunchokes are very rich in inulin, and there are other foods that are as well. Another one is chicory. That has inulin in as well. And chicory is used to make what? A coffee substitute. You can have chicory. It grows along the roadsides. I really like it. It's blooming this time of year. It's got a deep blue flower, and it's a beautiful plant and very hardy. And if you want chicory, you can go dig your own. You don't have to go onto the internet and buy it, or some store. You can dig your own. But they took these people and they gave them soluble fiber, and they're 3.15 grams, and they found that 4 hours later, just after one meal, 4 hours later, their FEV1 had measurably improved. That's as good as a drug.
What's FEV1?
That's what I was just explaining. That's the forced expiratory volume that you can get out in the first second when the person doing your pulmonary function test says, take a deep breath in, Now blow out hard and fast. That's what they tell you, and they measure how much volume you can get out in the first second. Forced expiratory volume first second, FEV1. Question?
So the recoil that you were talking about, the lung comes more cellophane like. Can that be reversed, like someone who's a smoker, say, they stop smoking?
Okay, so the question is, can that elastic recoil improve? And the answer is not completely, but to some extent. And what we're doing when we feed people soluble fiber is we're reducing inflammation, and it happens within 4 hours, which is amazing. Because if you reduce the inflammation, you're not improving the recoil, but the lung tubes, if you will, the bronchioles relax, and you can move the air better when the inflammation goes down. The question is, how does that work? Really interesting. Your gut microbiome has a huge impact on inflammation in your system. If you sit down at a meal and eat a burger and fries, your inflammatory markers will go way up. If you sit down and eat a plant-based meal that's whole food, colorful, your inflammation goes down, well, number one, as I mentioned, because of color, but number two, because of fiber. Bacteria in your gut metabolize a lot of what you eat. You thought you did it, but they're in there working for themselves and for you. Your microbiome is there working for you all the time. And if you feed it fiber, you will select for bacteria that make short-chain fatty acids, one of which is very anti-inflammatory, and that's butyrate. The butyrate works right there on the level of the gut where those bacteria are, produces this butyrate, the bacteria do, which stimulates the cells that line the colon to make more mucin, or mucus, if you will. They also tighten the cell-cell junction so you don't get a leaky gut, which if you get a leaky gut, that's going to increase inflammation, and I can explain why that is. But that butyrate doesn't stop right there. It gets into the bloodstream, and it goes throughout our body and reduces inflammation in other organs, particularly the lungs. So within 4 hours, these little bacteria start chewing away on that soluble fiber, insoluble as well, but particularly soluble fiber. The body starts absorbing butyrate or butyric acid that the bacteria have made, and inflammation starts going down. So there's two mechanisms from a plant-based diet that's whole food that inflammation goes down. And to get an effect within 4 hours is really remarkable. You know, that's about like taking an inhaler. If you take a steroid inhaler, it's not going to work any faster than that. Albuterol will, but not a steroid inhaler. So you can use food as medicine in this case, and we find the same thing with the interstitial lung diseases as well, which is next, interstitial fibrosis. Well, we'll go to lung cancer next, then I'll pick up interstitial fibrosis. So number one, to improve COPD, you want to, of course, minimize or eliminate smoking and exposure to secondhand smoke. And although it's not here, also air pollution. I remember I had a patient who had been a heavy smoker, and she threw her cigarettes into the fireplace when she quit smoking. And later she told me, I had a terrible urge to run outside, climb up on my roof, and suck that smoke in. Well, you know, even wood smoke isn't good for your lungs. But tobacco smoke, even through a chimney, isn't good for your lungs either. So smoke of any kind can worsen chronic obstructive pulmonary disease. Lung cancer. With this, lung cancer is not so much dietary. It's primarily, at least so far, maybe next year I'll tell you it is, but so far it looks like primarily smoking and secondhand smoke, as well as air pollution. And then there's some other substances we should avoid. Radon, and that's often found in our basements. And so we do radon mitigation. Asbestos. You know, when I was growing up, I remember playing with asbestos. Hopefully nobody else did. Well, I didn't know it was bad for me. We used to think it was the neatest stuff, and don't do that. Nickel, cadmium, chromium, all of those are related to lung cancer, and you certainly, if you're a metal worker, you don't want to be grinding them and aerosolizing the metallic particles without, you know, a really good mask. Not one of these masks like we're wearing to prevent COVID, but a really good air purifier, air filtration system. That's lung cancer. You can make a big difference if you follow that advice carefully. Then interstitial fibrosis. Interstitial fibrosis leads to pulmonary fibrosis, and that's stiffening of the lungs. And I've had a number of patients with this condition, and I've never given them any advice about diet. And I wish I had, because if you go to the pulmonologist, basically they say, well, we'll see if this disease progresses rapidly or if it doesn't. And there aren't a lot of things that we can do to help it. There are some experimental medications that may help, but we're not sure. But this is something that people have been working on and seeing really good results with, and that is reducing inflammation by addressing the gut-lung axis. Now, I've already told you about butyric acid and butyrate. That's part of it, and so you'll see that I want you to increase soluble and insoluble fiber. Just like with chronic obstructive pulmonary disease, if we can reduce the inflammation, we slow the disease. The same thing is true with interstitial lung diseases, which result in pulmonary fibrosis. If we can reduce the inflammation with fiber, we make a big difference. But we also need to address the gut-lung axis. The bacteria that are in your gut can get out, particularly if you have a leaky gut. Now, you remember I just mentioned leaky gut, and if you're eating a diet that causes inflammation, like those burgers and fried things, barbecued, that can cause leakiness between the cells that line the colon particularly, and then bacteria that normally live in the colon can get through there and into the bloodstream. Now you've got bacteria floating around, and where do you think they go? Well, they kind of go everywhere, but particularly to the lung, and you change the microbiome of the lung. And it's interesting that the bacteria that predominate in the guts of people on a standard American diet also cause inflammation wherever they go. And so if you're on a standard American diet and you get a leaky gut or breakdown of that cell-cell junction, and the bacteria get into the lymphatic system or the circulation, they make their way to the lung and cause inflammation. We used to think that the lung was sterile and didn't have bacteria in it. Not so. It does. Not as many as the gut does, but it does have quite a few, and that causes inflammation as well, which is why it's really important to eat an anti-inflammatory diet, both by eating food that's rich in antioxidants and eating food that gets the butyrate-making bacteria nice and happy, but also avoiding food that ups the level of bacteria in your gut that cause inflammation, because they cause it not only in the gut but also in the lung. And this is the first thing that I know of that can alter the course of pulmonary fibrosis. And anything that we can do to alter that course, because pulmonary fibrosis from interstitial fibrosis is the lung stiffens, and people can't get air in well, and they can't get air out well, and it effectively reduces the lung volume. So you just don't have as much ability to move air. I saw a gentleman in my office a few months ago, and then I saw him again recently, and he said, "I'm not doing too well." He has interstitial fibrosis, and I'm having trouble breathing. Before, he was fine if he sat still. If he walked across the room, he'd get a little short of breath. He's on oxygen. Now when I saw him, even sitting still, he's panting. So I talked to his pulmonologist today, and the pulmonologist said, well, we probably ought to get hospice involved because there's nothing we can do. I wish I'd known about this when we first diagnosed him 4 or 5 years ago, because we could have changed the slope of the deterioration and he'd be doing better now. There's nothing worse than not being able to breathe and having to work at breathing when you're sitting still. It's okay if you run up a hill and you get winded, you can slow down. But if you get winded sitting still, that's tough. And so this really hit home to me when I was reading this. Here we have something that's simple, doesn't cost anything, I mean certainly not more than eating any other way, that changes the course of interstitial fibrosis. We don't have long-term studies on this yet, but it looks really promising. And what have you got to lose? Nothing. In fact, you'll not only improve your own body habitus and lungs, but the climate as well, because we know that raising animals for human consumption is as big a problem in the environment as the whole transportation industry. And so if you're worried about climate change, be careful what you put on your plate. Then pulmonary infections, and this also goes back to interstitial fibrosis and COPD, because the more infections you get, the more inflammation you have, and you accelerate both interstitial fibrosis and COPD. And that is anything that we can do to reduce pneumonia or bronchitis will slow those diseases as well. The first thing is maintain excellent dental health. There was another study published in British Journal of Medicine showing that poor oral health, poor dentition, infections and gum disease and all of that is related to pneumonia. How does that work? Well, the bacteria that cause infection are by and large anaerobic inflammatory bacteria. And do you think you ever get bacteria from your mouth into your lung? Well, yeah. It's not very far away, is it? And you're swallowing food all the time. I mean, I hope you are. And it's really close between the trachea and the esophagus. It's like right there. And so what's here does get down into the lung. And if these bacteria in your mouth are healthy, and the kind that you get with a good clean mouth, then you're going to have less lung infections. So be careful if you have teeth that need work, see your dentist. it could save your life as well as your teeth. And that's really important to keep in mind. Another thing that you can do to reduce pulmonary infections and infections in general is maintain a healthy immune system. And we've talked about that quite a bit over the years in this Food for Health program. You want to remember that if you're going to get a flu vax soon, anybody going to get a flu vax or a flu jab as they call them in Britain? Well, what do you want to eat the day before you get that flu jab? Kale. One big serving of kale will more than double your immune response to that flu vax. Now, if you don't like kale, you can choose spinach or collards or any deep green leafy vegetables. They stimulate the immune response, not inflammation, but they prepare the immune system to respond to infection. So when you're eating good greens, it improves immune system function without increasing inflammation, which is exactly what you want. So if you eat a diet that's rich in colorful foods, fruits and vegetables, your immune system improves. Going back to asthma, remember I said eating more fruits and veggies. I could break that down further based on that article and say that vegetables worked best in men. Fruits also worked well in men, but in women, it was the fruits that worked the best. The veggies didn't do quite as well in women as they did in men. I guess that's because ladies are sweeter and they like that fruit, I don't know. But the fruits are really good for reducing inflammation in our lungs, and women seem to benefit even more than men do from the fruits. But I'm not going to stop eating fruit.
Was there specific fruit that are?
The colorful ones, and most of them are. And if you're going to eat apples, of course, the antioxidants are in the apple, but particularly in the skin. Remember, apples are in the so-called dirty dozen, so you'll want to have organic apples if you're going to eat the skin, ideally. But you want those colorful fruits. Then lastly, maintain adequate hydration to prevent infection. Why? Well, the lungs have a mechanism to sweep stuff out of them. They're cilia that sweep, just like the broom in your house, and they sweep mucus. But if the mucus gets thick, you can't get it out. How do you keep it thin? Water. You want to keep yourself well hydrated. That will help the mucus in your nose, which is the first line of defense against pulmonary infections, and in the lungs. So that's a little bit, maybe more next year. Any questions that you have about lifestyle and lung disease? Question?
Yeah, so I wanted to ask you about the indoor air quality. When you were talking about
You know, that's a really important thing. In fact, more air pollution is indoor than outdoor. And one of the best things, Lynn, come up, well, I can just, one of the best things you can do for indoor air quality is plants. The palms. Areca palm is a really good one. Bamboo palm is a good one. Help me, Lynn, what are some of the others? She's the expert on cleaning the air with plants.
If you're interested in cleaning your indoor air with plants, NASA did some research on it.
You got to come close so you can hear my, so they can hear you.
NASA did some research on it, and if you Google it, it'll pop up. And you'll see an article, and it lists the different plants and which ones seem to be the best for taking toxins out of the air.
Ivy works. The English ivy works quite well. What's that? The peace plant works well. And then the palms are the best.
But But some plants are really good at like absorbing things out of your computer. So it's
The plastics.
the plastic. So it's really interesting to see this and take a look. And you know, the wonderful thing about plants is when you have them in your house, it gives the house a nice ambience as well.
Yeah, the house looks nicer. The air is cleaner. You want plants in your home.
Lynn, did you remember the site that you referred to?
It's a NASA, and it was a NASA research project. NASA.
National Aeronautics Space.
Yeah, they were doing it for like,
To take on the flights up to Mars. They wanted to keep the air clean. So they were playing with plants and found, hey, they really clean things up. And that's good. Orchids do pretty well too.
yeah.
And I like orchids.
So
And the nice thing about orchid, if you buy cut flowers, how long do they last? A couple weeks, maybe, if you're lucky. An orchid, if you buy one blooming, it'll last for a few months, and it doesn't cost much more than cut flowers. And if you're Lynn, you can get them to bloom again and again and again.
the nice thing about plants is that, they say in order to get perhaps optimum results, you need a lot of plants. But I would just encourage you, whatever space you have that would look nice with a plant, to enjoy it, but don't feel pressured to fill your entire house with plants. But just know that whatever you're able to put in will be good.
Put one in your bedroom. You usually spend a lot of time there. Yeah. All right, any other questions? Yes.
You said something about the nose, the mucus of the nose. What about the throat?
Well, where does the mucus in your throat come from? Your nose. So take care of your nose. There are mucus cells lining the mouth too, but the same thing is stay well hydrated. And avoid really dusty environments because that clogs things too. Question?
I'm miffed on the biogut concept that you're talking about. I got a little bit confused.
The microbiome or the gut-lung axis?
Well, it's the cellular structure that's leaking that
Okay,
I don't
so-
know how to fix.
Okay, so to keep the gut from leaking in relation to the microbiome, you want to eat a lot of fiber and avoid food that has been cooked at very high temperature, and avoid food that has been burned, and avoid food that has very few antioxidants in it, which means I'm describing the preparation of animals for food. Here's an illustration I've used. How many of you have gone fishing? Anybody gone fishing? Okay, we got one here. You go fishing, you pull the fish out of the water, what does it smell like? No, it doesn't. Anybody been fishing more recently? It smells like water. You put it in your cooler and you take it home and it smells like fish. Why? Because the fish has started to oxidize before you froze it. Then you fry it, okay? Or bake it or whatever. Every step in that causes oxidation of the fish or whatever you're cooking. Because animals, when I die, is there any use for my body anymore? Not really. It's supposed to decompose, oxidize, rot. But plants, particularly the seeds, they need to live, right? To reproduce. So plants are packed with antioxidants. When we die, we aren't. So if you eat a dead animal, and if you're going to eat fish, what you do is pull it out of the water and bite it quick. But then you're going to get some parasites, so be careful. You're better off to go to your garden and pick the tomato and bite it quick. The more you prepare the animal product, the more inflammatory it becomes. So you want to avoid that sort of thing, reducing inflammation. You reduce inflammation, then the gut doesn't leak as much. There are other causes of that, but a screwed up microbiome is that. Alcohol can, but it causes irritation. I mean, if you get a cut and you pour alcohol into it, what happens? It hurts. If you drink alcohol, you irritate the lining of the gut, and we know that because alcohol increases the risk of esophageal cancer. That's where it hits first. Mucus helps protect you from alcohol, and so you don't get so much oral cancer or stomach cancer because they're lined with mucus, but the esophagus doesn't have that mucus lining, and so esophageal cancer. Yeah, good question. Any others? One more.
It's not precise, it's on the inflammation.
Okay.
Have you run into anything about intermittent fasting in relationship to killing off inflammation?
Yeah, great question, and the answer is yes. Intermittent fasting reduces inflammation because you're eating less frequently, you're giving your gut a rest, and it's one of the best things you can do for reducing inflammation. However, if you're going to do intermittent fasting and you're going to say, I want a space every day that I'm not going to eat, the best is to eat a good breakfast early in the morning, a good midday meal, and skip supper. You're not going to get near the benefit from intermittent fasting if you eat lunch and then a late dinner or dinner. You want to get that first meal of the day.
12 hours.
Yeah, 12 hours or longer.
Or longer, right?
Yeah. If you keep your food intake within 6 to 8 hours, you're going to do better with intermittent fasting than if you just eat for 12 hours and then not the other. Question?
Fermented foods like kimchi, I know is good. But
Yeah, that's what this
highly
is. This is fermented.
I know, but what about highly seasoned?
Okay,
food?
so highly seasoned foods, it's interesting. Let's look at pepper, for instance. If you get pepper in your eye, would it hurt?
Yeah.
Would it cause inflammation? Okay. How about black pepper versus red pepper? Well, red pepper is hot because of capsaicin. Capsaicin has antibiotic properties and kills Helicobacter pylori, the major bacteria that causes stomach ulcers. So if you're going to use pepper, you're better off to use red. What about black pepper? What makes black and white pepper hot? Piperidine. And that causes breakdown of the mucus layer of the stomach and increases your risk for ulcers. So if you're going to use pepper, use red pepper. But be careful, highly spiced foods, if they would inflame a cut or your eye, they'll inflame your gut to some extent too. Now,
I eat kimchi all the time. I make my own.
yeah, good. Just use red pepper, not black. Yeah, and so then you don't have near the problem. But I would be careful with too much of the irritating spices. You're fine with some, but be careful with the inflammatory ones. That's a whole nother topic maybe we should do. But if it would burn your eye, it might burn something else. Anyway, well, thank you for coming.
There was one more question.
One question.
There was an individual had a question about essential oils and lung health.
Essential oils and lung health. The way to use essential oils is better to nebulize them, and they can be helpful, but be careful if you're using irritating essential oils like cinnamon oil. That's going to be irritating. Other oils, which ones? There's some essential oils, for instance, if you look at the balsam fir, that has an essential oil in it. That fragrance stimulates the immune system in a really positive way and increases T cell activation and has been shown to reduce infection. But some essential oils are irritating, so we'd have to take them on a case-by-case basis. Again, thank you all for coming. We're just scratching the surface, but if you have interstitial lung disease or you know someone or COPD, think about fiber and colorful fruits and vegetables. That's really important.
Who was the doctor, Robert
Dixon.
Dixon?
Yep. He's at University of Michigan. And he has written a lot about the lung-gut axis.